The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Welcome to the third installment of the South Carolina of Office of Rural Health and DHEC's Best Chance Network and Wise Woman Rural Training Series. This third installment is focused on billing for success, effective strategies for generating revenue with the Best Chance Network and Wise Woman programs. I am your moderator today. My name is Tiffany Simpson-Crumpley, and I serve as the Education and Training Consultant for the Center for Practice Transformation. Joining me today are Ms. Latasha Chandler. She serves as an IT service analyst for the Best Chance Network program. And also joining us today is Ms. Genevieve Gamble. She is her counterpart, but for Wise Woman. So these ladies have been gracious enough to lend their time and their expertise to walk you through effective strategies and troubleshoot common mistakes that happen in the billing process. So I know that many of you are right in the process of implementing programs, but we're also going to be presenting information to newbies just about basic components of both of these programs. Our hopes for you today is that by the end of this presentation, you'll have some basic information about both programs. They're going to give you step-by-step instructions, broad steps, because there's many moving pieces, but they're going to walk you through the high points, the required points to get you paid at the end of the day. And at the end of this, really talking about how we view self-pay patients, how through these two programs, if you implement these programs effectively, a self-pay patient could be profitable for your practice if you're strategic around leveraging both of these programs. Really quick, the Best Chance Network program is South Carolina's branded breast and cervical cancer early detection program. It provides comprehensive screening and diagnostic services for low-income uninsured women, and is commonly referred to in the community as the mammogram program. Quick eligibility criteria review. Women who are served by this program must live in the state of South Carolina, must be 30 to 64 years old, and effective July 1st of this year for cervical cancer screenings, they can be as young as 21. And for mammogram, comprehensive breast examinations, if a woman has a history of breast cancer in her family or she's symptomatic and she is younger than 30, that can be approved on a case-by-case basis. Women must not have any type of health insurance, meaning, or if they have health insurance, they're underinsured. So, for example, their insurance only covers hospital care. For some women that have policies through the Federal Health Insurance Exchange, also known as Obamacare policies, if they have deductibles of $1,000 or higher, they do qualify for services. Also, if they have insurance that does not cover diagnostic services, they could be eligible for BCN. And of course, they must meet eligibility requirements, and those requirements are posted on the DHEC website. Just a quick review visually, the impact breast cancer mortality rates. If you look at the darkest pink shades, these are the areas of the state that are most adversely impacted by breast cancer. And when we say mortality, we're talking about deaths of women that could have been avoidable had they gotten into treatment or screening early. If we were to layer a map of that of heart disease, these often the PD region is hardest hit by chronic disease, whether we're talking about cancer or heart disease or hypertension and the diseases associated with those conditions. And that's why we are so passionate about having you on today, because in your work all day, every day, you have the opportunity to touch a woman's life and get her the services that she needs. To save these programs literally save lives, and you have a role in that. So we're going to jump right into our subject matter for today. Miss Latasha Chandler is going to school you on best chance billing strategy. She is a native of Andrews, South Carolina, so she's a rural girl. She graduated from Howard Adult Education Center with a medical terminology certificate. She has served as an IT service specialist for DHEC since 2007, so she is a veteran with DHEC. In her daily responsibilities, she processes claims, does data entry for lab and radiology reports, fields BCN billing questions, and provides on-site training for onboarding BCN programs. So if you are a site that is interested in the Best Chance Network and implementing, if you have a group of at least, I'd say 7 to 15 ladies, if you have multi-sites where you're implementing this program, on-site training can be provided, and Latasha is an excellent teacher. So I'm going to let her show you her teaching skills, and she's going to talk about how to fill out billing forms correctly for Best Chance Network. Latasha, it's all yours.
Hello, I'm Latasha. I'm going to walk you through how to fill out the billing form for the screening. Change, Tiffany?
There we go.
This is actually the screening form for the office visits. And it's very important that you complete the entire form. It may take a while to fill it out, but it's important. The easiest way to ensure that you are not missing anything is to go to each question at a time without skipping anything. We know this may take a little longer. However, there are some questions that are required in order for us to process the claim. Always use the screening billing form that's up to date, and always provide your provider label on the top. The most common mistakes is on the billing form, we have like the service date that is very important to filling out. We have in section A, we have the race is very important. We have on section D, where you go down, it's the CBE. The section E is the hysterectomy reason, and the pelvic exam results. Those are very important in filling out the screening form. All claims must be submitted within 30 days from the service date. If you need help, you're very welcome to call. Please call me or email me. Next, Tiffany. BCN billing tips for success. Make sure to fill out each section BCN form completely. The most common mistakes is submitting claims without required information. This causes delay in payments. Go one question at a time without skipping anything. Some questions are required to process claims in a timely manner. All claims must be submitted within 30 days from service date. If you need help, please call or email. Next slide.
And for those of you on the call, Latasha's contact information will be provided at the end of this webinar, so please do not panic. This will not be the last time you see her contact information.
BCN billing form completions. Step 1 is to capture the required information, which is the patient's race, the comprehensive breast exam result, the hysterectomy and hysterectomy reason, pelvic exam questions. Without these questions, your claim can be placed on a hold and your payment delayed for incompletion forms. Step 2 is to submit your claim. Send in just the white original bill form. Keep the carbon copy for the patient's chart. This is required to be in the patient's chart for compliance per the BCN contract guidelines.
Thank you, Latasha. If you all have any questions, please use your chat box on the right-hand side of your screen. I will be monitoring the chat throughout this session, and we do have devoted time for a Q&A session. So if questions come up for you, please feel free to use the chat function. Okay, we're going to keep this train moving to the Wise Woman program. And so we are very intentional about presenting the Best Chance Network and the Wise Woman programs because I refer to them as the dynamic duo. There are clinical linkages between unaddressed hypertension and heart disease and vulnerability for developing breast cancer, and it's well documented. So that is why we present these together at the same time. And so with that said, since 2008, DHEC has offered the Wise Woman program to ultimately reduce factors in heart disease for low-income women 40 to 64 years of age. Services focus on cardiovascular disease screenings, health coaching, and lifestyle changes with a focus on controlling high blood pressure. And as I've mentioned, it is a companion program to BCN, and you must be a BCN provider in order to provide Wise Woman program services. Eligibility requirements. Just mentioned, you must be a BCN provider. A South Carolina resident. The woman must be 40 to 64 years of age, has no insurance or high deductible insurance with hospital coverage only, and income falls below 200% below the federal poverty level. And with that said, I have the honor of introducing Miss Genevieve Gamble. She is going to coach us today around Wise Woman billing strategy. Miss Gamble is a resident of Eastover, South Carolina, another local lady. She is a graduate, 2014 graduate from Midlands Technical College. She holds an associate's degree in applied science of administrative office technology and also holds a certificate as an office support specialist. She has served with DHEC since December 2015, and she directs flow of Wise Woman clinic and laboratory data throughout the division. With that said, I am going to turn it over to Ms. Genevieve Gamble.
Hello. I'm here today to go over the Wise Woman and to help you to generate revenue. One of the processes to ensure you generate revenue with Wise Woman is to complete and submit the Wise Woman form. Right here we have up the patient health assessment form. The Wise Woman form consists of two forms. That's the patient health assessment form. Next slide. And the clinical building form. Tiffany, next slide. Okay, and that form, the clinical and billing form. With these forms, each one of these forms have step-by-step instructions that explains how to fill out these forms completely. Even though you may give a verbal explanation on how to complete the forms, new staff members or the patient may not understand just by hearing. They may need to see the written instruction in order to complete these forms completely. We also, now that's with the patient assessment form. The patient is going to complete that form. I think that the staff member should assist the patient with filling out the patient health assessment form. Like I say, being that it may be a little bit complicated for the patient, and also since this is a form that helps generate revenue for the providers, it would be, I think it would be appropriate for the staff member to assist the patient, being that this is your revenue. It helps you, if the form is completed correctly, you get the revenue that, that's supposed to come to you. So back to where I was saying that the instructions with the form, it helps to give a clear understanding of what is needed and what is required, because the questions that or on the patient health form are questions that CDD requires us to ask. So that is the reason the questionnaire is the questions are being asked, because they are required by CDC. So on the clinical billing form, the nurse or the assistant should complete this form, and when that form is completed, the lab report should be attached to that form. One more thing I failed to mention is that with Wise Woman, the Wise Woman visit should be done on the same day that the BCN visit is done in order to get paid for that visit. Both has to be done on the same day. And with that form, back to the clinical and billing form, we have the patient information that needs to be done, the visit information, and we have the clinical measurements, and also if it applies, we have the alert workup area on this form. Next slide. Okay, Wise Woman billing tips for success include instruction sheet with health assessment and clinical and billing form, which I've already explained that if you include these instructions, not only will new staff members understand what they're doing with the form, also patient, and that's in case you give your patient the form without, receiving any assistance, the patient can understand the form also. Staff members should assist the patient with filling out the health assessment form. Like I say, this is your revenue. The forms, determine if you get paid or not. If the forms are done correctly, your payment, you will get paid for your visit. So the next point is the nurse or assistant should complete the clinical and billing form and attach the lab report. I feel that, well, it is important for the nurse to do the clinical and billing form because of some of the areas whereas you have the height, weight, blood pressure, and once the visit has been done, the patient is being seen, some of the questions, the nurse is able to fill out as the patient is being seen. And if you have any question as far as filling out the forms, you can call me direct at 803-898-1494. Next slide. Okay, with Wise Woman, we do have some common mistakes that are made, and there are easy ways to avoid them. Some people use outdated forms. All new versions of the Wise Woman forms are embedded. There are some not making sure the forms are completed or having the response to the question is asking. Sometimes we do receive forms that are incomplete. It's like some patients skip here and there. And an example is like for question 1 through 3. Those 3 questions ask about high blood pressure, cholesterol, diabetes. If you answer no to any one of those questions, you can skip to the next question. But if you answer yes, you have to complete all of the questions that's under that specific question. Tiffany, the form for a second so I can kind of like give a picture of what I'm talking about.
Okay.
The health assessment form.
Health assessment? Okay.
Yeah. I see question 3. So we're going to go with question 3. It says, do you have diabetes? We have yes, no, and don't know. If a patient says yes, she is to answer question 3A and 3B. If she says no, then she is to skip to question 4. So that's why I said that question 1 through 3, you do have an option of a skip pattern in there if it applies to you. Okay, back to the mistakes. Okay, so not taking the second blood pressure. We just ask that if you can, please take the second blood pressure. We do now on the new form. We do have an area where if the patient refused, you just check the patient refused. Unchecking fasting status and missing lab reports. Okay.
Anything else you'd like to impart to the participants today?
Yes, one more thing. With the fasting status, we do need that check because that is also a part of determining where, if you get revenue or not on certain parts when it comes down to the lab, because you have two different types of labs you can take, and I am not going to get into all of that today, but there is a reason why I say we need the fasting status. Also, missing lab. Please send in lab reports, because if you do not send in lab reports, you will not get paid. Now, if the patient refused lab, there is a spot where you check patient refused labs. But lab reports are very important to come into us, because that is also a way in which you generate revenue. And please send your forms in within the 30-day period that we requested. Thank you.
Thank you, Ms. Genevieve. I want to review two things that were not in the text of the presentation today, but I think they're particularly important for both programs, is this idea of helping patients with their forms. As we all know, we do deal with patients that could be functionally illiterate. So you hand them a form, and especially with any type of clinical information, cholesterol, blood pressure, that can be completely overwhelming. So Ms. Genevieve, thanks for making that point. And also that the BCN and Wise Woman visits, if you are offering both programs, correct, Ms. Genevieve? If you're offering both programs, the ideal is for those visits to be on the same day?
Correct.
Okay, so what if you're a BCN provider and you eventually add on Wise Woman? Is it okay to do separate visits, or is it always required to do them together?
It's required to be done on the same day as far as the services, okay, as far as being seen.
Okay.
But as far as if a patient has to come back for different parts of the Wise Woman visit, that is okay, depending on what the patient is coming back for. And that's what I'm saying. It's kind of like, it needs to be, we have different depths of the Wise Woman program.
Yes.
So I'm just hitting the high points on today.
Yes, yes. And that's something that I wanted to share with the participants today. Wise Woman has some other moving components to it. It's not just the initial screening. It's a health coaching component, lifestyle change, curriculum for women to participate in. So because of that, we're going to revisit Wise Woman in a May webinar, and we're going to get into the nitty-gritty of the different parts of the Wise Woman program. So don't worry, for those of you that are interested in Wise Woman specific content, we will be providing that for you. Before I move into the next part of this presentation, Latasha, are there any common mistakes that you see that we haven't discussed today that you'd like to just give some tips on?
I'm sorry, Tiffany, it broke up, so I couldn't hear what you said.
Are there mistakes that you tend to see on the Best Chance Network side that you'd like to offer advice for today?
Oh, yes. We have a lot of forms come in without the hysterectomy reason. That is very important, because if we have the we need the hysterectomy reason in order to, that's part of getting a payment. And we have a lot where they miss the pelvic exam result, and then the CBE. Also with the CBE, we have some results that may be abnormal. That is not actually listed on our form, but is okay to write that on, because if not, we have Brittany in the office that will be calling you for missing information, and you don't want to get a call from Brittany.
Okay. And I just,
so the most important part of this form for payment is just always try to remember, it's very important to complete it, but always try to remember filling out the race, the CBE with the result, the hysterectomy reason, and the pelvic exam results. That it gets you faster payment.
Any other pearls of wisdom before we move forward today?
Just complete the form.
So y'all hear that? Complete the form. No shortcuts, no getting around things, because that's what gets you paid. And then that's proof in the pudding that you provided high quality care when you've dotted your I's and crossed your T's. So that is the main takeaway. Complete the forms and help the patients if you need to. So with that said, really, what is your why? Why are we doing this? Why are we emphasizing this? And really answering the question, the WIIFM question, what's in it for me? Number one, both ladies have emphasized that today, that when these services are provided and implemented correctly and the forms are done correctly, it's increased revenue for your practice from initial screening appointments and follow-up visits for both programs. For Wise Woman, patients can receive free diabetes prevention education and lifestyle coaching to promote healthy eating and physical activity. And for those of us that are privately insured, sometimes we have to pay for those services, and these women are able to receive these services as a part of being a Wise Woman participant with no out-of-pocket commitment from them. Many of you are going through quality improvement processes in your practice. Some of you may be participating in the patient-centered medical home accreditation process. You have to meet HEDIS measures. All of these programs set you up to perform effectively where you can renegotiate your contracts with payers, and as well as the physician quality reporting system. So all of these program requirements align you for better reimbursement across the board. Also, by serving as a point of entry for these programs, you have the opportunity to provide a comprehensive medical home for your patients. Now let's talk about how much money can my practice make from serving women effectively through these programs. The scenario that I'm presenting to you today is based on just one initial visit and one return. So for a BCN breakdown, if you provide the initial visit, do all the services, fill out your form correctly, that's $102.68. Annual rescreening visit. So we don't just want women to be screened one time. We want to get them in the habit of having the CBE and their pelvic exam every year. So we want to bring them back. So don't just do it one time. You want to bring them back, so you're making sure that you're monitoring them. And so also for revisits, for an office visit, and you say you establish that patient in your medical home, that's an additional $102 that's coming to you, to your practice, for a total of $254.86. Now, what if you're implementing Wise Woman as well? For a new patient visit, assuming that you fill out all the forms correctly, put those labs on there, do what Miss Genevieve told you to do, that's $120 to your practice or your health center. And revisit for counseling if abnormal values come back for high cholesterol, high blood pressure, or a woman is identified as a diabetic. That's $69.15. In many cases, these programs reimburse better than the going Medicaid rate for the exact same services. So you're looking at a total of $190 for Wise Woman by itself. But again, we want to be intentional about you offering these programs at the same time, because it provides good comprehensive health care for a woman that qualifies for both of these programs. So guess what? For one woman being served effectively in this program, you can earn up to $445. Imagine if you went into your EHR and identified women who fit the criteria, the eligibility criteria for BCN and Wise Woman, and were proactive about reaching out to them. If you just did 10 a month, that would be $4,500 a month coming into your practice. what could you do with those funds? You can hire another staff person who could be devoted just to working with these programs alone, or expand the capacity to serve more women by being able to recruit another provider. Who knows? But that's just for one woman, 1 year. So I just wanted to emphasize that, because I believe that many of our rural practices are leaving money on the table through these worthwhile programs that are not being implemented right now. Also, a plus is, as I've mentioned before, if you are working these programs and implementing them effectively in your practice, you can also achieve milestones for different standards in the patient-centered medical home program. I will not be going into detail today about that, but this is just an example of how these services align with the different standards. Meaningful use, you receive credit for cervical cancer and breast cancer screenings. As I've mentioned before, for HEDIS measures, when you are effectively and consistently implementing breast cancer screening and cervical cancer screenings with the women that you serve, you can renegotiate based on improved performance in these areas. Same goes for MACRA and MIPS, which are enhanced payment opportunities for folks that are implementing these opportunities or these programs. Now what? So we've given you all of this information. Now what do we want you to do? So this is somewhat of a review from the last two presentations. Really what we have learned as we've been working with the team at DHEC and both Best Chance Network and the Wise Woman programs is that in order for your practice or your clinic to be successful, there must be one person dedicated to shepherding the program. Now, while it is not their sole responsibility, they are the coach in your practice, and everybody has defined roles for working these programs. In those instances where it's not a dedicated staff person to implement BCN, be responsible for the forms, pulling reminders out of your EHR, things of that sort, we find that those programs struggle with implementation. So if you are implementing right now, you need to designate someone who is responsible and implement a team-based approach to implementing these programs. We can't emphasize enough that you can use your EHR to proactively reach out to women that meet this criteria, but also you can activate screening reminders via the computer. So if the front desk person is checking someone out, they can encourage them to participate in the programs if they meet that criteria, but also activating text reminders. Some of you have invested in services like Televox or some type of telephonic texting services. We find that practices that do that, women are better engaged and more likely to come back for annual rescreenings. And if you've seen one BCN program or one Wise Woman program, you've seen one. Everyone has a unique way of implementing the program. So we want, and we're here to help you determine the workflow practice that works for you. These are just some other tips. Rip off and duplicate forms that work for your staff and clinicians. In the first webinar, we presented a cheat sheet in terms of what clinicians need to do in terms of making sure they capture that information that Latasha was talking about on that billing form. We're more than happy to provide things like that so you can customize internal documents or cheat sheets that will make things easier on your team. Relationships are key. That's why we have folks that are doing this work on a daily basis, so you can get to know them, so you can pick up the phone and say, I don't understand this process. Can you help me? Those programs that have solid relationships with DHEC staff or liaisons in the community, we find that they tend to function better as programs. This is, and then finally, there are some practices that only have maybe 3 positions: the clinician, the nurse, and the front desk person. If you need manpower, consider partnering with your local technical college, the medical assistant program. This would be a wonderful learning opportunity, and set up a relationship where you have rotating interns that can help you and be those extra hands to help you with BCN and Wise Woman implementation. If you are currently a BCN provider, we strongly encourage you to become a Wise Woman provider as well. If you're not either, we encourage you to sign up for both. Just some reminders for existing BCN and Wise Woman providers. All claims must be submitted in 30 days from the date of service. Do not hold claims because you could risk payment, not getting your payment for service. For BCN practices in particular, please submit all outstanding claims by the 19th. I am now it is now time for a question and answer session. I will be monitoring the chat box, so if you have questions, please enter them at this time. Okay, so Jennifer, I did receive your request for Latasha's information, and we're going to provide that at the end of this session today. Are there any questions? You can also raise your hand if you would like to answer a question and go live. So that is also an option for you as well. Just scrolling through, making sure no one has any questions. And if you, in your user panel, you can click on the hand section and have any question that you need answered. Also, we'll be providing our contact information. Let's see, we have another question. All right. Well, it looks like we don't have a lot of questions today. If you think of something, please feel free to contact me. My name is Tiffany Simpson-Crumpley, and I will field your questions or route them to the appropriate parties. I want to take a moment to just highlight some upcoming opportunities for future training. Next week, beginning in the month of May, every week we will be having webinars for Wise Woman services. So next week's webinar will be addressing the front desk and the impact that that has on the service experience. So we've talked a lot about the technical aspects of implementing these programs, but as you know, just like when you go to a restaurant and you order food and the waitress gives you the stink eye or she has an attitude, that impacts whether or not you're going to even come back to eat at that restaurant. It's no different in our healthcare. And so when we're dealing with vulnerable patients, we have to remember that the frontline staff, not only the frontline staff, but you set the tone for the rest of the visit, and you are extremely important in terms of whether or not that woman will come back. And so it also sets the tone for the rest of the team as well. So I will be walking you through just some pointers in terms of just reminders of effectively engaging patients, and it really comes down to excellent customer service. And all of us know when people treat you like a VIP, you'll keep coming back for services. It's no different in healthcare. So so I encourage you to join me next Thursday, May 4th at 12 noon. Just want to make sure I'm not missing anything. Also, if you need help or if you are right in the midst of implementing your programs, please reach out to the Office of Rural Health's team. I'm getting ready to provide information shortly, but not only do we provide a technical assistance, we work in tandem with DHEC. We all work together as a team to make sure you have what you need to implement your programs effectively. But at the Office of Rural Health, we have a patient-centered medical home accreditation team, talented quality improvement coaches that can come into your practice and analyze your workflow, look at your EHR, is it optimized to help you meet those clinical measures, macro technical assistance if you're getting ready to go through that process. And if you are a designated rural health clinic, we have team members that can come in and make sure that you're in compliance to keep that reimbursement rate as a RHC, as well as good coding and billing advice from veteran coders and billers that we have working for us. So, key contacts. This is Latasha and Genevieve's information. What I want you all to know is that within 24 hours, we will be sending out the recording. So if you didn't catch the information today, you can review this presentation again. Here's Latasha and Genevieve's information. If you have specific questions about billing forms and how to fill them out correctly. And then we have the leadership. Ms. Trinessa Jones is the Best Chance Network Director. If you are interested in being a provider, she is the person to contact. And her companion or counterpart is Linda Peckery. She is the Wise Woman Program Manager, and so if you are interested in implementing Wise Woman, contact her as well. I'm Tiffany Simpson-Crumpley. My service is providing education and training to providers, and so please feel free to reach out to me with any questions you may have. If something is not working for this training, please give me your feedback. We will also have a survey that's going to pop up at the end of this session, so you can immediately provide real-time feedback as soon as this session is over. And then we have LaShonda Pettaway Brown. She is a QI coach that does on-site technical support for PCMH programs and is our EHR expert. With that said, let me make sure one more time we don't have any questions. Yes, Miss Jennifer, we're going to provide this presentation to you. You can wait for the whole recording, or I can send you separate slides. Just contact me. And that is it. So it's 12:41. Thank you for sharing your lunch with us. Just giving your time on a Friday just lets me know that you all are really committed to doing this good work. And join us for future webinars. And please, please, please fill out the 5-question survey at the end of this webinar. Thank you.
Thank you so much for saying abnormal things that's not on the form. Because I was like, when she said that, I was like, yes.
You told me, yeah, you fought me the first time, but you came around me.
Yeah,
I was so nervous and
because Deja was like,